Hello again. It is now Thursday, August 9th, and today Renee had the first of the second round of treatments. We're a little behind in recording videos, so this I think is going to cover treatments 3 and 4 of the first round, the A and C chemicals. Correct?
Yep.
Right. All right, so take it away.
All right, so I did have my first, what I called that, my first of my last treatments. So number 1 of the 12 treatment with Taxol. So still a little bit doped up, so you can probably see it in my eyes a little bit. But anyways, we figured we wanted to make sure that we don't get too far behind and I start forgetting how things were and mix stuff up, because that's easy to do. So the third treatment of AC, the oncology nurse had warned me that it was going to be the worst one. I had high hopes that I was stronger than it, but it kicked my behind. So it already started with a pretty bad omen. My port closed up, so they had the hardest time to draw blood. They literally had me, I don't know, put my hands in the air and stretching hands, look the other way, cough. I don't know what the heck we were doing. All kinds of stuff. I mean, they were working on me for about 15 minutes just to try and draw blood through the port, and it just would not do it. They finally, I think, got a little bit of blood that they sent away, but then after that they had to pull out what they call the Drano, in not so nice terms. So they put some of that stuff inside the port and it had to sit for 20 minutes, which turned into 45 minutes because she was extremely busy with other patients. So when that was all said and done, I got all my, all my pre-treatments, the steroids, the nausea medications, everything you get every single time. That takes about an hour, and also because I had some prior kind of reactions where I kind of got dopey and felt like I was underwater, she slowed everything way down after that. We also went to see the doctor on that one, so that added more time. So I think when everything was said and done, it was 5.5 to 6 hours that we pretty much were there, and that made for a very long day. After I was done with that, I think I rested pretty much what did work on Friday, but I mean I pretty much rested. No, I worked on Thursday as well.
Worked on Thursday
while we're in the chair because it was a long time. I worked on Friday from home, but started feeling pretty bad already. Slept through the entire weekends. And then Monday came around and I still felt really bad. For some reason, because I'm a glutton for punishment, I still, we just had a lamp fall out of the ceiling. That was interesting. I think I have plaster on my head. So, where were we? Monday I went to work, glutton for punishments. Felt really bad. I think I came home at about 2 o'clock. I made it to about 2, which wasn't bad, but just nauseous, feeling run down. The acimidrian gave me an extremely bad taste constantly in my mouth. And I think that contributed to the nausea. I'm getting sick of pills, so I think I took 1 nausea pill and then went, you know what, I just don't want this. So I just lived with the nausea. Constipation was really bad again. So just overall pretty horrible. Tuesday I went to work. I think I did pull a full day on Tuesday.
Yeah.
I almost started out extremely bad. I had a couple of meetings, and literally, I know English is not my native language. However, I think I speak and understand it very well. I was in a meeting, and people were asking me questions, and I had no clue what they were saying to me. Nothing registered in my brain in the morning, and I went like, okay, if this is the way this is going to be, this is not going to work for me. I kept pushing through, trying to take copious notes to make just to keep my brain going, and I think by noon I kind of overcame that. So to me, that's a really good sign that it kind of helps for me to kind of push through things.
Yeah.
And go to work. I mean, people keep telling me, hey, Renee, you need to give your body time to rest. And yes, that's true, but I have a sit-down job. I just can't let my brain be affected too much by this. And I'm not sure if it's the chemo alone that gives you what people call chemo brain. I think it's the kind of giving up and just laying on the couch all day and not exercising your brain, and on the other hand have all this misery in your head the whole time that you're going through this. And the more you think about it, the more scared you get. The more you get on Google, the more you look for stuff, and no wonder you get like brain overload and you start forgetting everything else. So this just keeps me focused on my work and keeps me focused away from constantly thinking about cancer. I mean, there's days that go by or hours that go by, and I'm just, pardon my French, balls to the wall all day long, and I come out of it and I go like, oh yeah, I have cancer, that's true. So I mean, it helps me. I can tell you one thing, number 3 is really the first time I questioned if I could do this. It was, like I said, I'm not going to sugarcoat it. I questioned if I could do this one and then another 12 weeks up until October. That just seemed so far away. So, also got another mouth sore. Whenever I would get up, my heart would start hammering. My forehead got extremely itchy to the point that I was just constantly scratching it, and it started getting bumpy. So I called the oncologist and asked him about it, and he says, well, I can give you steroid cream, but it thins the skin, so the best thing is to just use regular cortisone. And that did help. So I mean, that has 1% steroids, and he says it does say on the tube that you can only use it 3 or 4 times a day. He said you can just use as much as you want, so which definitely helped. So again, I'm sure I'm better off than most, but that third one just really was the the worst one. I was pretty much sick with that one until my next treatment. So really not any days that I felt like, oh, I feel good, I can recharge before the next one. So kind of glad that because my son was not here, my son Shanna was not here for the third one. So I was kind of glad that my son came over for the fourth one, because you love to see your kids and you have something bad but definitely something to look forward to. My son by my side, so that really helped. It also helped that when my son was there, every single time my son's there, my port does not close up. So Leah was told by the oncology nurse that he's no longer welcome.
I'll still go.
So
she needs somebody to drive her home.
Yeah, exactly. The fourth treatment, and again, I always thought this would be a cumulative, so I figured the fourth treatment would be really bad as well. But that one went much better. My port was open. It was a shorter length. I had the Neulasta, and which you have with every single one of those. I did not take anything to counteract the effects of the Neulasta, as you saw in prior videos.
The Claritin.
You normally take Claritin to ward off bone pain. I really didn't have any, so I'm sick of pills. I'm sick of medicine, so I'm like, no more Neulasta either. No, no nausea medicine. No Neulasta. I even did not take any laxatives or anything for constipation that week either. Not to say that I wasn't constipated, but I just tried to drink more water, eat more fruits, and I finally overcame it on my own. So that one I totally slept through the weekend, which was pretty great. I think, I slept Saturday all day long while watching movies. We have all the movie channel, so it was like pretty much falling asleep to one movie, waking up into the next that entire weekend. And Monday I felt really, really good. I think I pulled a full day on Monday. But then maybe I went home at like 4 o'clock, something like that. Went home a little bit early. I was pretty much good by the next weekend. I did take Wednesday, Thursday, Friday off before that next weekend, which was kind of nice because I got to relax a lot. I did, again, had a bad taste in my mouth the whole time, and when you have a bad taste in your mouth, you automatically get nauseous. So this time I got an added symptom, which was it's like strong odors of cleaners actually put a taste on my tongue, and it made me feel like the taste that I had when I put the acimidry in the Red Devil. So I literally one evening at a party we did have a little party here, not here, but at the hall, and I walked into the restroom and they had some kind of cleaner in there, and after I smelled that, I was done. I mean, I was totally nauseous. I felt horrible. It just shows you how much your mind is starting to mess with you. So we also had a little spritzer here in the house that would spritz some kind of, which normally I love
Air
that
freshener.
smell, air freshener, and every like 20 minutes or something like that. And we had to turn that one off because I could not freaking stand it. So
The scented wax things, the Scentsy handle things, and that had to be turned off because that was too much of a smell.
My deodorants made me sick. So yeah, I didn't believe it. I thought people were kind of winos about the bad smell, but it's real. So
yeah, it was really kind of wild because it kind of wiped out her sense of taste, but exaggerated her sense of smell.
Oh, yeah, it was horrible. Yeah. I also got a totally white tongue. I woke up on Wednesday, and I'm really, good about brushing my tongue. I've done that all my life. My mom used to do it. I do it. So I usually have a nice, pretty pink tongue. And I woke up and my tongue was just totally nasty, gross white. So started reading up about it. Pretty much sign of a yeast infection, which is normal because again it kills all the bacteria in your mouth. It kills everything that's that's good also with the bad. So I got a yeast infection, which is called thrush. Called it in, and they recognized it immediately, so they gave me a prescription for some stuff. Leah will put it right down here somewhere, the name of it. It's awesome stuff. You just swish it in your mouth. It's They say it's cherry mint. I thought I was going to hate it, but the taste is really not bad. I was told to swish and what did it say?
It said swith and spit.
Swith and spit, but swish and then spit it out. For some people that wait too long, so if you get this, do not wait too long. But if you do wait too long, it can go down your throat, and then it's swish and swallow. So, which can give you some GI tract issues. So, try and catch it as early as possible. It's a wonder drug. It literally cleared up in 2 days, so was really nice. Kids came over for the weekends because we did have our annual party here where we live, which is always you know, a big fest with a lot of people. Hundreds upon hundreds of people come for that, and you know, we pretty much played in the pool most of the day. I sat by the pool most of the day, Friday and Saturday, I think.
Mm-hmm.
So I bite, you know, mostly in the shade and things because of light sensitivity and sun sensitivity of the chemo. But yeah, I mean, really good weekends. I'm pretty happy with that. And then by Monday I felt totally normal again, so I actually had my 3 days back that I felt really good. Probably gonna give away a little bit of this treatment. This was again the first of the last treatments of Taxol. 1 more to go. 11 more to go. Where's 1 more to go?
Yeah.
11 more to go. 1 down, 11 more to go. Again, Leo was there, so my port closed up, so I had to do all my exercises. Luckily, no Drano this time, which was kind of nice. She got it to work. With Taxol, the carrier that they put in there to actually carry it into your body, a lot of people have a lot of bad reactions to that. So they will totally hop you up on Benadryl and steroids. So all the pre-meds and stuff I was trying to work, and at a certain point I was trying to finish something that I was trying to finish something up because I was starting to feel really drowsy, and I got to the point that I had to ask Leo what things said, and I'm like, okay, this is it, I'm just gonna save it, I'm not even gonna do this, I'm gonna tell my folks that I'm logging off. And I could barely write an I am to somebody before I like literally just totally zonked out. So yeah, your first Taxol treatments, just expect to just friggin' sleep through the whole thing, which is what I did. So again, I'm filming this video tonight, so I'm feeling really good. We took the dog for a long walk. You know, I'm a little bit tired. My eyes are dry. They're tearing a lot, so I'm not really sure if that's from that. It kind of started before this morning already, so I don't know what that's all about. Might be a new symptom, but we'll see. So yeah, I mean, Taxol so far so good. Knock on wood. We'll see. Then one more thing, we talked to the surgeon as well last week on Wednesday, just to go over what's going to happen in 11 weeks, timelines and things like that. What are the expectations? And he threw me a pretty big curveball that I'm not happy with. I'm still trying to come to terms with some of this, because it just threw all my expectations for a loop. So basically the timeline will be, I will be done with chemo by the end of October. Of course, Taxol has some side effects, and one of those is neuropathy, where you it starts damaging the nerves in your hands and your feet. So he did say if that gets really bad, they will stop at 8 weeks. So it might be earlier, it might not be. If I continue on down the path that I have been going on, then I will be taken to the meds very well. and I should be able to finish my 12. However, if I get that neuropathy, we'll cut it at 8. So it's either end of October or end of September. So we'll see. They're gonna do a full mastectomy the end of October. November. Sorry, end of October. In November.
Yeah, gotta wait a month.
Yes. End of November.
Mm-hmm.
End of November, December. Sorry. Full mastectomy. Ovaries removed, fallopian tubes removed, and a port removed. Then he'll probably give me some time off, and here comes the curveball. I was told that if we were going to do chemo, that we weren't going to be doing radiation.
Mastectomy. If you're going to do a mastectomy, there wouldn't be the radiation. That was with a lumpectomy.
Yeah, a chemo and a mastectomy.
Yes.
Was no radiation. Radiation was, chemo and a lumpectomy. So, did not expect radiation whatsoever. Radiation is every weekday for a duration of 6 weeks. I mean, that's not so bad in and of itself, but since we're going to be doing radiation, they won't be able to do the plastic surgery and install the expanders at the same time that I get my mastectomy. So I don't really get to start on that at that time. The other bad thing about radiation is that they gotta let your skin recover for about 6 to 12 months. So I will be without breast for 6 to 12 months during that time. Then they would operate and put the expanders in. I don't know how long that takes to actually expand the skin, but the problem with radiation is that it hardens the skin and it will not be as supple as it would be without radiation. That means that the fail rate of plastic surgery and getting what I call my airbags is fairly high. So again, thrown for a loop. Radiation, they're already going to remove the lymph nodes. After we went to go see the surgeon, he confirmed that my lymph node right here is pretty much totally gone, and everything in here is softening, and he can't find any cancer anymore in there by touch. Yeah. So
chemo's working.
Yeah, I mean, I don't know at what points, and I'm coming to terms with this myself, so I'm kind of fighting it in my brain, but I don't know at what point they're just trying to throw everything at you to get you to 100% guarantees. So, to me, life doesn't bring 100% guarantees, and to be busy with this for 2 years and then still have the possibility of having it come back and not being able to enjoy my life in those years coming up to it is kind of a tough choice to make. So like I said, I'm still coming to terms with if I even want to do radiation or not. So, but that's a personal choice that I would be making. I mean, anybody that wants to ensure that they live and wants to get that 100% guarantee, that would be their choice. But I don't know, I'm just not there yet, and I guess you guys will be following me through that decision making process. It's not easy, and we knew it wasn't going to be easy.
Right.
It's going to be a tough year with a lot of tough decisions to make. So that's where we are. I just wanted to keep it real, let everybody know that, yes, I'm strong, but it's not a walk in the park. I definitely have my moments. And I will have many more moments
Yeah.
to come. So, thank you all for watching.